Asking blue pill, red pill, corporate press, I've had my fill. I'm just a simple chap, believing in my own will. Web fire, math evil, scheming, this is no drill. Haters masking boosted, but still with no chill. Need to come and take it if you wanna mess with my hill. We've been 3D printing, set and ready for that ghost kill.
Hello, Canada, and welcome to another episode of The Maple Pill. As always, I'm your host, Matt McKeever. Tonight, we've got a special episode where we're really just going to be discussing what's going on with the Canadian healthcare system, looking a little bit into the past as well as the present, and then talking a little bit about the future as well. And so I've been meaning to make this episode for a while, but things just kind of kept popping up. So I was ready to release this episode, and shoot it back right before the Freedom Trucker Convoy, but then that all happened, and that really I think took a lot of our focus, and justifiably so, as we saw all kinds of craziness spill out of that. Then we've had the Emergencies Act enacted, and then finally the conflict in Ukraine between Ukraine and Russia. So enough kind of dilly-dallying. I thought, let's sit down and talk about the Canadian healthcare system. And I'd love to hear your thoughts, your opinions, and your personal experiences in regards to the Canadian healthcare system. So let me know in that comment section down below. I've had to use it a few times, but, not a regular user, I guess, of the Canadian healthcare system. I've always been told, and growing up, it's a world-class healthcare system. We should be proud of the fact that we've got free healthcare here in Canada. And, thank goodness we don't have healthcare systems like they do in, say, the United States. That's the way I was kind of raised. And I suspect for a lot of us that are, born and bred Canadians, that's likely how we view the system. Sure, every now and then I'd see a headline about, maybe we're at capacity and things of that nature, but it never really directly impacted me. So I never spent a lot of time dwelling on it. But as we kind of entered the COVID era of the mainstream media news cycle, I guess is what I'll call it, it really stood out to me that, we were constantly seeing hospital capacities and the strains on our healthcare system as a justification for different mandates, whether it be mask mandates, vaccines, vaccine passports, requiring people to get vaccinated in order to keep their employment. And this really caused me to want to dig a little bit deeper into it. So I'm not sure if you guys remember, but one of the first episodes we ever shot, I actually pulled up this graph here. And so this is just from the Ontario government's website. And essentially what it was highlighting is just the ICU capacities for beds here in Ontario. And a couple things that stood out to me. One, I was like, man, isn't Ontario like a really big province with a really large population, all things considered? And this doesn't seem like that many beds, really. But again, what do I really know? I'm definitely not an expert when it comes to healthcare. Although one thing that did stand out to me was simply the fact that, going into the pandemic, we essentially had just over 2,000 ICU beds. And at the absolute peak, our capacity for ICU beds was 2,500. But, since kind of that peak in summer of 2021, we've been hovering around the 2,400 ICU beds. And right now, as of the shooting of this video, we're at about 2,350 beds. And so, again, when I'm kind of looking at that big picture, I'm like, okay, I guess during the pandemic, we roughly increased our capacity and stabilized around 15% increase in ICU beds. That sounds like a net good thing during a worldwide pandemic. So what do I know? But again, this just stood out to me as something a little bit different or off in regards to what I was seeing here when looking at the data. So it caused me to want to dive a little bit deeper. And then a couple of the influencers that I follow on social media, one being Tommy Caldwell. And I really encourage you guys to follow him, TC Fitness Mentor on Instagram if you're not. Tons of great health and fitness information he's constantly sharing. He's got a wonderful podcast as well. Again, linked to this story as well, all the stories I'm going to share tonight. But he dived back into the archives and started highlighting different news articles. And so he's got one here from 2008, another from 2011 and 2013. 2008, London Health Science Centre at capacity, patients facing long waits and cancelled surgeries. 2011, Ontario hospitals have lowest bids per person. 2013, hospital crowdings despite strains, Ontario hospital lobbying for more bids. I was like, okay, so this seems like maybe it's been going on a little bit longer than the COVID pandemic. And a quick Google search of, Ontario hospitals at capacity, you'll find pretty much every single year, at least one or two, or usually most of the mainstream media news outlets having headlines like this. This one's from 2017, But again, whether we're talking about headlines in 2008 or 9, or we're looking at headlines in 2017, 2018, and 2019, or what's been going on during the pandemic here through 2020 to 2022, all these headlines feel interchangeable, other than the fact that the ones pre-COVID don't mention COVID, but still, essentially, we've got the same problems in our hospital system. So from Toronto Star in 2017, Ontario health system headed for crisis with overcrowded hospitals. Then jumping over to the Globe and Mail in 2018, now more than ever, we need to solve Ontario's healthcare crisis of capacity. And so just want to highlight here from Stephen Panwazi, a great Twitter thread he shared. And again, just highlighting all kinds of different headlines. And all these headlines actually are pre-COVID. So again, we're looking at 2 major GTA hospitals ran at more than 100% capacity in first half of 2019. Another one from 2019. Storage of bodies in rented trailers leads to probe of medical examiners space shortage. It's not sustainable. Hospitals in northeastern Ontario at or over capacity. Quebec emergency rooms pushing well past capacity. So again, as I started, diving deeper into this, I'm just like, man, it seems like this is actually just a continuous issue. And all that's really happened during the COVID era is the government now has a little bit more justification for why we're at or surpassing capacity from, whether it's a beds or ICU beds issue. And again, really encourage you guys to jump into Stephen's entire thread here, but just want to highlight a couple more of these headlines. And so again, this is all pre-COVID. So the vaccines here mentioned in these headlines actually refer to flu vaccines. So vaccines delayed as provinces overcrowded hospitals brace for flu season. Hamilton's hospitals overflowing heading into flu season. 3-year-old Quebec girl dies of influenza. Overcrowding at Queensway Carleton Hospital, frightening NDP leader says. And so again, the reason I just want to highlight this is while every now and then they may tweak what the narrative shows, nothing's really changed that much in Canada's healthcare system over the last couple years, or really over the last decade or two. But if we look on a longer time horizon, it is interesting to see the evolution of our healthcare system. So this is from the World Bank, hospital beds per 1,000 people in Canada. And you'll notice there's a steep decline starting around the mid 70s, or I guess starting in the early 80s, actually, all the way down until we find ourselves in the present day. So again, back in 1976, we had 6.9 hospital beds per 1,000 people in Canada. Around 1996, we were at 4.6 beds. And now coming into 2019, which is the earliest or the latest data they've got here, we're looking at 2.52 beds in Canada. And this is really interesting because from my perspective, while definitely some of the funding aspects have changed, we're still spending a substantial amount of our GDP, of our government funds here in Canada on our healthcare system. And yet we seem to have less beds, constantly be at capacity or over capacity, and we're seeing wait times continue to expand. So jumping over to Wikipedia here, this is just a list of countries by hospital beds. And again, this goes from 2013 to 2017, but we're going to jump into some more recent data in a second. But we'll find Canada way down here near the bottom of these 40 countries at number 36. And so again, we can see from 2013, 2.71 to 2017, 2.52. Now compare that to a country like Japan. Again, there are multiple differences here and certain things do need to be taken in consideration. So when we're looking at countries like Japan or say Germany, they definitely have different demographics going on. And Japan in particular has a much older demographic, particularly during this period of time, compared to maybe where we find ourselves in North America or other Western European countries. But Germany has a similar set of demographics as well. So again, something just to be aware of here. But it is, I guess, jarring when you think of the fact that Japan has, 13 and we've got 2, right? Or 2.5. So essentially, Canada lagging here by about 4 or 5 times what's going on in Japan. Next, jumping over to trending economics, hospital beds by country. And so again, I think this is from 2019, if I remember correctly. And we're going to find Canada down near the bottom again, where we're looking at 2.52. So the reason I want to highlight this first is just to kind of establish some common knowledge, because I think for a lot of us here in Canada, unless we need the healthcare system, we're not paying a lot of attention to it. And we probably should be paying more attention to it, because as we hopefully again come out of this COVID-19 pandemic era, there's still going to be a lot of consequences to the policies that were enacted over the last few years, right? There's been a ton of delayed surgeries or canceled surgeries, and lack of cancer screenings and non-urgent medical procedures and things of that nature. And it really feels like we're probably setting ourselves up for another catastrophe here. And I guess the reason I bring this up is twofold. One, I'd love to not see it be a catastrophe in the Canadian healthcare system. And two, I think we all are going to have to be more proactive in how we engage with our healthcare system and what we demand from politicians and administrators when it actually comes to our healthcare system, because the trajectory we're on here now is not good and it's not sustainable, in my opinion. Jumping over to hospital news, Canada ranks last on number of hospital beds and wait times. So despite spending more on healthcare than most other developed countries, this is from 2019, so right before the pandemic, but then we're going to jump to a Fraser Institute article that's from 2021 during the pandemic. But despite spending more on healthcare than most other developed countries with universal coverage, Canada has a relatively short supply of doctors and hospital beds, and the longest wait times, finds a new study released today by the Fraser Institute, an independent, nonpartisan public policy think tank. Canada's healthcare system remains one of the most expensive in the world, yet struggles with a comparative dearth of medical resources and comparatively long wait times, said Bacchus Baru, Associate Director of Health Policy Studies at the Fraser Institute and co-author of Comparing Performance of Universal Healthcare Countries 2019. The study compares 28 universal healthcare systems in developed countries, spotlighting several key areas, including cost, availability, and use of resources, access to care, and health of Canadians. So jumping over to the study here, and again, I really encourage you guys spend some time and look through this data yourself. But this is from the Fraser Institute, and just pulling up the executive summary, I wanted to highlight this infographic they've got on page 2. So Canada, one of the highest spenders among universal healthcare systems, ranks modest to poor on performance. So looking a little bit closer at the data here, as far as healthcare spending as a percentage of GDP, Canada is second. So we spend the second most after only Switzerland. But looking at doctors per thousand, we're 26th. Looking at hospital beds per thousand, we're 26th. Looking at specialist weight, we're 10th. And so on the surface, again, there's other factors here we need to take into consideration. For example, if we weren't at capacity and we had the lowest number of doctors or the lowest number of hospital beds, wouldn't necessarily be that big of an issue. And we could maybe highlight the fact that maybe Canada's investing a lot in preventative measures rather than focusing on like sick care. They're really focused on healthcare and trying to prevent people from getting sick in the first place. However, again, based upon the headlines we've reviewed over the last couple decades, doesn't really appear to be the case. And then looking at Switzerland, which is the first overall in GDP spending when it comes to healthcare, they're 5th in doctors, 10th in hospital beds, and 4th in specialist wait times. So certainly, if you're going to be number 1 in spending or number 2 in spending, I would choose Switzerland, because while they spend a little bit more than Canada as a percentage of GDP, it appears like they're getting a lot more for their dollar. And that's something that I think we all need to spend a little bit of time thinking about and diving deeper into. Again, I don't have all the answers here. I just want to highlight for you guys some of the findings I found as I started going down some of these rabbit holes. Next, this is another Fraser Institute article, but this is from a 2021 report and study. So waiting your turn, wait times for healthcare in Canada, 2021 report. So this edition of Waiting Your Turn indicates that overall waiting times for medically necessary treatment have increased since last year. Specialist physicians surveyed report a median waiting time of 25.6 weeks between referral from a general practitioner and recipient of treatment, longer than the wait of 22.6 weeks reported in 2020. This year's wait time is the longest wait time recorded in the survey's history and is 175% longer than in 1993, when it was just 9.3 weeks. That's very significant. And again, we should really be asking questions. What's changed? And has our spending really changed that much? I think when you dive into the numbers, you'll find no, this isn't justified based upon solely, budget cuts, that there's more to this. And while I don't have all the data and all the information, again, I don't have the answers, my natural libertarian streak in me makes me suspicious that what we're probably going to see is, if we were to dive deeper into healthcare spending, that bloat in regards to budgets for administrators rather than actual practitioners. Continuing on from the article, there is a great deal of variation in the total waiting time faced by patients across the provinces. Ontario reports the shortest total wait, 18.5 weeks, while Nova Scotia reports the longest, 53.2 weeks. There is also a great deal of variation amongst specialists. Patient wait times wait longest between a GP referral and neurosurgical procedures, 49.2 weeks, while those waiting for radiation treatments begin treatment in 3.7 weeks. So again, sometimes it can be easy to lose the plot line here with the verbiage or talking in weeks, but like when we're talking about 53 weeks or 49 weeks, you're essentially saying it takes a year. Again, this should be very concerning for all of us in Canada, because as we look to going into 2022 and 2023, we already know that we've got a huge backlog of surgeries. We already know we've got a huge backlog or lack of like cancer screenings and more preventative medical, medical appointments and things of that nature. And again, even seeing doctors move from in-person appointments to online or by telephone, well, that in theory maybe helps them, mitigate any chance of COVID. I personally don't think that most medical practitioners right now have been trained to accurately diagnose and interact with their patients the same way online or via telephone or Zoom that they probably were originally in their when they were a resident going through and being trained in regards to in-person interactions with patients. So again, the reason I'm really bringing this up is I think that we're going to find ourselves with a lot more headlines going into 2022 and 2023, regardless of what occurs with the COVID-19 narrative. Now, here's just a infographic that they've got from their executive summary. So again, looking 1993, 9.3 weeks, 2021, 25.6 weeks, and 2019 pre-COVID was 20.9 weeks. So again, this is just wild in my opinion, and to not see it be more of a priority amongst politicians exploring this and trying to really figure out how do we fix this broken system. And understand, COVID didn't break the system. It maybe added additional strain to the system. It may be made for an easy scapegoat in the moment that we could just justify the reason things are worse is because of COVID. We were already headed on this trajectory. Next, from the Fraser Institute, comparing performance of universal healthcare countries 2021. So just want to highlight a couple key points here. Expenditures on healthcare. Canada spends more on healthcare than the majority of high-income OECD countries with universal healthcare systems. After adjustments for age, the percentage of the population over 65, it's second highest for expenditures on healthcare as a percentage of GDP and eighth highest for healthcare expenditures per capita. Use of resources. Medical resources are of little use if their services are not being consumed by those with healthcare demands. Data suggests that Canada's performance is mixed in terms of use of resources, performing at higher rates than average for OECD countries on under half the indicators examined. For example, cataract surgery and knee replacement, an average to lower rates on the rest. Canada reports the least degree of hospital activity as measured by rates for curative care discharges in the group of countries studied. So again, links to all these studies. I'm not going to be able to do them justice, just highlighting a couple of key points here. But again, I'm hoping to start a conversation with you guys, and I'd love to hear your thoughts, your opinions, and your experiences when it comes to the Canadian healthcare system. Here's, again, just a handy infographic breaking down some of these OECD countries and how they stack up. Again, we can see Switzerland was first in regards to healthcare spending as a percentage of GDP. Canada is second. But again, in 2021, we're still seeing 26th, 25th, and 10th, respectively, for doctors, hospital bids, and specialist wait times. And for the amount we're spending, we should be demanding more. We should be demanding more results from our government and administrators. A couple key points I wanted to highlight here from their summary. Canadians often misunderstand the true cost of our public healthcare system. This occurs partly because Canadians do not incur direct expenses for their use of healthcare, and partly because Canadians cannot readily determine the value of their contribution to public healthcare insurance. And this is an important thing for us to understand, right? One of the reasons I don't think there's as much accountability as there should be in regards to healthcare spending is because we don't see it clearly broken down, right? If the average Canadian, when they were actually submitting their tax return, saw this amount is going towards healthcare, I think that would trigger a lot more serious reflection on, am I actually getting my money's worth, right? Are we actually seeing results based upon the amount of money we're putting into this healthcare system? In 2021, preliminary estimates suggest the average payment for public healthcare insurance ranges from $3,842 to $15,039 for 6 common Canadian family types, depending upon the family type. So between 1997 and 2021, the cost of public healthcare insurance for the average Canadian family increased 3.4 times as fast as the cost of clothing, 2.2 times as fast as the cost of food, and 1.7 times as fast as the cost of shelter, and 1.6 times faster than the average income. So again, this begs the question, why is something where essentially the government has a monopoly seeing such cost increases when compared to other aspects of the economy, other aspects of what an individual needs in order to survive, and understand that those areas aren't Canadian or aren't monopolies by the Canadian governments. The 10% of Canadian families with the lowest incomes will pay an average of about $726 for public health care insurance in 2021. The 10% of Canadian families who earn an average income of $75,300 will pay an average of $6,521 for public health care insurance. And the families among the top 10% of income earners in Canada will pay $41,916. Again, this is all from the Fraser Institute. Link in the video description down below. Now, jumping over to the price of public health care insurance in 2021, another Fraser Institute study. Canadians often misunderstand the cost of our public health care system. And just wanted to highlight, this is from their executive summary, link in the video description down below. But let's actually pull up a infographic that just highlights it, right? So for that family of 4 with 2 adults and 2 children, they're on average going to be spending $15,000 a year on healthcare. And again, we can talk about whether that's too much, too little, but I think when we stack it up against other countries with universal healthcare systems, and we look at our spending as a percentage of GDP versus theirs, I don't see the justification for why Canadians should be spending so much more and getting less when it comes to their healthcare system. Canada's healthcare system is broken. Vaccine mandates make this problem worse. And so, as we've been discussing here for the last couple of decades, Canada's healthcare system's been on a negative trajectory, definitely deteriorating. We're getting less for our dollars. We're seeing longer wait times and things of that nature. But what really separates the end of 2021 and early 2022 from other periods or eras of Canada's healthcare system is vaccine mandates, and understanding that we saw several as in like hundreds, potentially thousands. It's really hard to get information on this. But a lot of healthcare professionals were forced out of healthcare because they weren't, for whatever reason, they wanted their own medical autonomy, and they didn't want to be forced in order to take the vaccines based upon the mandates. So understand, during a world pandemic, while we're also seeing capacity issues in our hospitals, both in regards to resources as well as staffing, we somehow still had the nerve as a country to set policies that would literally force out capable, experienced healthcare professionals simply because of our vaccine mandates. I find this really concerning. And again, on a long enough timeline, if we see ourselves continue down this trajectory, I think we're going to see significant consequences. And speaking about some of those consequences, let's look at one of the announcements that the Ontario government made. Ontario making historic investment in provincial nursing workforce. And this is actually from just like a couple days ago, March 7th, 2022. So nurses across healthcare system will receive up to $5,000 retention payment. Now, the reason this is important to discuss is for a couple reasons. One, I'm not shitting on nurses. I'm not saying they don't deserve this $5,000 retention bonus, but this isn't actually really going to fix anything. At best, this is triage that's going to help keep us from losing more nurses, at least for the next 6 or 12 months, because this retention payment is paid out in 2 portions, and I think the second one is in September. But this is a $763 million investment the Ontario government's making in these $5,000 retention payments, when, again, just a few months ago, we fired hundreds, maybe thousands of nurses here. It's really hard to know. Again, there's not a lot of data on it because of vaccine mandates. This seems very conflicting, I guess, when I look at the situation. And I'd love to hear your thoughts, your opinions. But that kind of wraps up for my discussion in regards to the Canadian healthcare system. But what I want to talk about next here is, what sort of solutions do we got? So one, I think a lot of us Canadians need to be demanding more from our politicians and administrators. We need to begin more involved. We need more transparency, more accountability. We need to understand really where is that money going? Why do we see our spending continuing to increase? Why are we still one of the top spenders in regards to GDP as a percentage on healthcare versus other countries when we seem to actually get less services, we've got less resources and longer wait times? This is important because, again, as I mentioned throughout this show, we've got delayed cancer screenings, we've had delayed surgeries, delayed medical procedures and things of that nature, and all of this feels like we're going to end up at a catastrophic moment at some point in the future in regards to the healthcare system if we don't find ways to change our trajectory. And so one of the things that I think needs to be discussed more thoroughly is actually focusing on, healthcare or fitness versus like sick care, right? Sick care is trying to treat symptoms. It's giving prescriptions. It's dealing with the damage after it's done. What I would consider healthcare or, fitness care or fit care, whatever you want to frame it as, is more oriented towards, how do we actually prevent this stuff from ever happening rather than having to be always reactive from our healthcare system. And so this probably comes down to education, creating better understanding amongst the general population. And again, I don't have all the answers. I'd love to hear what some of your suggestions are on how we can actually focus on healthcare versus sick care. But a few things that I see creeping up in culture in general that I know we've discussed in the past on previous episodes of the Maple Pill that are concerning is essentially we're starting to see, new narratives crop up in mainstream media and social media that, fat is healthy, that morbidly obese from an BMI standpoint is somehow okay and is actually in fact healthy. There are consequences, right? Like, while you may not want to be mean to fat people because you don't want to hurt their feelings, and that's a reasonable position to have, to want to paint with such a broad brush to say that any weight and any body size is healthy just is intellectually dishonest. It's factually incorrect. We can even just look at recently with the COVID-19 pandemic, who was most at risk? Individuals with pre-existing health conditions and those that were overweight. We've recently seen studies come out saying that even something as little as 60 minutes a week of cardiovascular activity is enough to reduce your risk in regards to serious consequences from COVID-19. And while I don't have the data in front of me, this is true for other health conditions as well, right? And understanding that at the end of the day, humans are just a system like any other system. And what I mean by that is we're the sum of our inputs. And so if you're constantly putting bad food, unhealthy food into you, how can you expect to have a healthy output from that, right? You're the sum of your inputs. You're the sum of your influences. And so I think what we need to be focused on more is creating general awareness and driving towards more healthier lifestyles here. Now, again, what I don't want to see is government overreach and mandating, how many calories you can eat or what types of food you can have access to or things like that. I don't want a brave new world, and I don't want the World Economic Forum controlling my menu, my personal menu when it comes to food. However, I do think that a lot of people don't understand the slow damage they're doing to themselves and by extension, the consequences to our healthcare system by binge eating, by, eating high sugar, high processed diets in regards to the food that they're consuming. So again, I don't have all the answers. I'm never going to pretend to have all the answers. I'd love to hear some of your thoughts, your suggestions, though, because again, we are looking at an even more severe health crisis. We were already on a bad trajectory here in Canada. And in my opinion, it's only going to get worse regardless of what comes next with COVID-19. So I appreciate you guys watching this video. If you enjoyed this video, if you like what I'm doing with the Maple Pill, please, hit that like button, subscribe if you're new to the channel. Who knows how long I'll be here on, big tech or corporate social media. So there's a link in the video description down below to my Rumble and BitChute channel. Really encourage you guys to check those channels out. If you don't like watching me on big tech, I don't blame you. Again, there are other options. I'll be uploading these videos always just a couple hours after they originally live streamed. And then in addition to that, if you guys want to follow me on Instagram, you can find me Matt McKeever Unfiltered. Essentially, at this point in time, it's almost just me sharing my political opinions, some memes, and things of that nature. And as always, if you guys want to send me anything in the mail, we actually do have our Mailbag Monday episodes where it's essentially me just opening up letters and random things from you guys.
Welcome,
I really appreciate it.
To the Mailbag Monday show with your host Matt McKeever. Let's open some mails, leave some smoke trails. Mailbag Monday. Send Matt a pack and it's gonna be a fun day. Mailbag Monday. Send Matt a pack, live stream every Monday. Mailbag Monday. Send Matt a pack and it's gonna be a fun day. Mailbag Monday. Send Matt a pack, live stream every Monday.
All right. Well, again, appreciate you guys watching this video. Appreciate those of you sharing the Maple Pill on social media, because big tech's doing me no favors ever since we got that first strike on the channel. Viewership's dropped off, but I do appreciate those of you that engage with the content, that leave me your opinions, share memes and story ideas on the Maple Pill channel on Discord. So again, links in the video description down below to the Problems or Profits Discord. Really encourage you guys to join it. It's just a community of like-minded individuals that are focused on self-reliance, self-resiliency, and making sure they're setting themselves up for the best possible life, regardless of what comes next. And until next time, again, just more than I've paraphrased this so often, but that Thoreau quote of, rather than fame than fortune, give me truth. And I think that that's what we need to be demanding at all times from politicians and administrators, but particularly we need to be demanding truth and transparency when it comes to our healthcare system. I appreciate you guys, and I'll see you on the next video.
Asking blue pill, red pill, corporate press, I've had my fill. I'm just a simple chap, believing in my own will. Web fire, math table, scheming, this is no drill. Haters masking boosted, but still with no chill. Need to come and take it if you wanna mess with my hill. We've been